Welcome to your Partner in Health podcast. I'm Dr. Caitlin Prickett, board-certified internal medicine physician and founder of Concierge Medicine of Boca Raton. Joining me is my partner in everything, my fiance and business partner, Jeffery Runyon.
This podcast is intended to come from a perspective of a patient, physician, discussing healthcare matters. We'll discuss many healthcare matters throughout this podcast.
But before we get started, it's important to note that this podcast should not replace the professional opinion of your healthcare professional for any evaluation and treatment. If you do have questions, please consult your healthcare provider.
With that being said, let's jump right into our subject today, whole body MRI.
I love whole body MRIs. They are something that we utilize almost every day as part of our practice.
So I'd like to talk about how we utilize that, the MRIs in our practice. What do you look for when you're using these MRIs? What are we targeting? What is the demographic of the people that we're targeting with these MRIs?
So in our practice, we take a very personalized approach to health and wellness. And whole body MRIs are just a tool that we use for an overall personalized health and wellness plan for each and every patient. It's a tool that we can use to be proactive about a patient's health and focus on early detection. So the type of patient I recommend for whole body MRIs is pretty much anyone who wants to, one, look and see what's going on inside of their body, underneath their skin. Make sure there are no stage 1, stage 2 cancers, aneurysms, masses, tumors, fatty liver, things that are asymptomatic, but that we need to know about so we can do further evaluation and treatment. It's also for people who want to be as proactive about their health as possible. Patients who are very on top of health and wellness. The whole body MRIs are a great modality we can use to further look at their bodies. And also it's great for people who maybe have family history of cancers or certain diseases and want to get the best screening approach possible. So it's really men, women. In our practice, I see ages 30s to 80s. That's the majority age group for patients. Now, the whole body MRIs, I already mentioned some things like the cancers and aneurysms, but it can also detect things like fatty liver. Fatty liver is a big issue for a lot of people. It's important to know if you have that. People with one kidney, you may not know that you have a kidney, but whole body MRIs can detect a solitary kidney, which is important because if you have one kidney, well, there are certain measures you can need to look at now to make sure you take care of that kidney. Because, by the way, you're supposed to have 2 kidneys, not just one kidney. So, but it's important. And just little things like that. The whole body MRIs can also look at the volume of your brain. And we can look and see with subsequent scans if that volume is shrinking. And that can be an early sign of dementia, even before a patient starts to have cognition or memory issues related to dementia.
That's pretty amazing. You mentioned cancer. So what are currently, prior to whole body MRIs, what is the standard screening procedures we're looking at right now as a patient? If I go see my doctor regularly, what are some of the things he's going to recommend or she is going to recommend I do out before the whole body MRI?
Unfortunately, there are only 5 main cancers that we routinely screen for here in the United States. Those are breast cancer, which is we utilize typically mammograms for those, and those are usually recommended annually for women. Cervical cancer. So cervical cancer is detected with pap smears, and we also check HPV along with those pap smears. HPV is the virus that can lead to cervical cancer. Lung cancer screening. So lung cancer screenings aren't recommended for everyone. They're only recommended for a certain age group of patients with a certain pack year history. Pack year meaning how many years have they been smoking a pack of cigarettes a day. So for example, if you have been smoking 1 pack of cigarettes a day for 20 years, you have a 20 pack year history. We also screen for colon cancer through typically colonoscopies, although you can use some other tests like the Cologuard test as well. And then prostate cancer. So prostate cancer is, of course, tested in men, and it's typically done with a PSA blood test. And that's it. That's all for the screening tests. All the other cancers, pancreatic cancer, liver cancer, we don't have routine screening tests for those. We typically, in the general medical field, wait for patients to start to develop symptoms or have some sort of derangement in their blood test before we start screening for these. And that's where the problem is. because we're only screening for 5 out of many other cancers that we can develop.
So how many other cancers are being screened with the MRI, the whole body MRI?
Well, the whole body MRIs can detect 500 different disease processes, including cancers. And so it's going to detect masses, which masses or tumors can be benign or they can be malignant, meaning they're cancerous. And so the whole body MRIs can look for those tumors and masses, those abnormalities that could be stage 1, stage 2 cancers. And I want to mention something else about screening guidelines, because they are developed by these societies and medical agencies, and they change. Recently, the colon cancer and lung cancer screening guidelines changed. So for colon cancer, it was you started colon cancer screening at age 50. Now it's 45 years old for people, because they realized that starting colon cancer screenings at 50, we were missing people developing colon cancer between the ages 45 and 49. Enough people developed colon cancer between that 45 and 49-year-old space before they were like, hey, we got to back it up and start colon cancer screening for everyone at age 45. But how many people had to die of colon cancer, have very severe cases of colon cancer, who were in that age group that got missed because the standard guidelines didn't pick them up because they were less than 50 years old? So point is, those guidelines change, and there's always a lag in the changing of those guidelines. And that's where the whole body MRI scans can come in, and you can take control of your own health and be like, well, I'm not 45 yet, I'm 35, but I still want to be screened for all the different types of cancers.
Yeah, so what you're saying is you don't have to be a biohacker or a longevity expert to want to go out there and be proactive about your health. And it seems like everything you read online about whole body MRIs and being proactive in your health, you kind of get labeled a nut job, I guess. You get labeled that you're
That's
a biohacker, or because Kim Kardashian, an influencer, told you about doing this MRI. Beware, because the person that is kill the messenger, essentially.
Right.
But essentially, you could be killing the patient because you're fearful of some of of being labeled a biohacker or listening to an influencer. Yeah. When really, as we see, evidence-based medicine changes, so does technology changes with that. So if we're looking at these as proactive tools, and obviously there are some negative things that we've heard and we'll discuss here in a minute. But from what we're talking about right now, not just cancer, but look at dementia and the brain shrinking. If we can look at these things, we now know from studies that have come out that dementia and Alzheimer's isn't just an elderly disease. It happens years and sometimes decades before.
Yes.
So if we're using a tool like this, we can see those things and be proactive and possibly be on the tip of the spear of attacking these diseases that are killing millions of people worldwide. Yes,
and in our practice, we take a whole body approach to patients, where we're looking at patients' physical exams when they come in for their annual exam. We're looking at their extensive blood tests, and the whole body MRI is another tool that we use to look at the patient as a whole. We're not waiting for we don't take the sit and wait approach. We're not waiting for patients to develop symptoms to come in to finally decide, okay, we need to screen you for this, this, and this. We are practicing that proactivity as well. Exactly. And yes, there are a lot of stigmas out there about the MRIs, but the beauty about this technology is it's a direct to consumer option, where patients don't have to have the approval of their insurance company or an order from their physician. They have the power and they can take control of their health. And I think there's this beautiful paradigm shift happening in medicine. It's not that paternalistic doctor's order, I'm only doing what the doctor tells me type of approach. It's now patients, because people are well educated. And now they have the power to do a whole body MRI, to order some of these extensive blood tests, to take control of their health. And I think that's really where medicine is going in the future.
Well, I think that is a great thing too. And I like you pointed out, these MRIs can pick up stage 1, stage 2, where you're far more likely to survive. A 5-year survivability rate for 1, 2 stages are greatly increase if you get to stage 4. Most of these cancers that we're not testing for, like you said, the routine screening that the standards of care is set up for right now, such as pancreatic cancer.
Yeah.
You can survive pancreatic cancer if it is detected early.
Yes.
Or your survivability is better off.
Yeah, the 5-year survivability rate is much greater detecting it at stage 1, where it can be completely resected, as opposed to a stage 4 when it's already in your pancreas and spread to other areas of the body. I mean, the 5-year survivability rate for pancreatic cancer at a stage 4 is like 1%.
Yeah, and what are the symptoms you're looking for too? I wouldn't personally know as a patient what if I get a bellyache. Am I thinking pancreatic cancer? Obviously, if I Google it, I may get there eventually too. Yeah. Amongst the other 100,000 suggested diagnostic tools I can get from Google, right?
Yes.
But if I'm using a tool like this, I go out there, I walk into an MRI center, and obviously they're not all the same. There's multiple vendors out there that do it, and some are better than the others. So if we're looking at the one we use, which is Pronuvo, their technology is different. So they're looking at software, they're using AI, they're using things out there that can help look at images better. Their images are 10 times clearer than some of the other, like your traditional MRI center, the one at the hospital you'd see. So if I'm using those tools and I can I get my scan back and I go to my physician, say it's you, what kind of tool is that? Obviously you like to see these tools.
Right.
So if I bring this report to you and I can then be proactive in my health and see it, because I'm not going to get a standard of care, my routine maintenance, let's say, like my oil change and rotate my tires. But if I'm saying, hey, I'm going to go out there and make sure I'm the healthiest I can possibly be and get this MRI and look at these things out there. And obviously there may be false positives out there, sure. But if I see the symptom of my belly aches, I'm not going to think it's pancreatic cancer. Right. But if I were to catch it, and then there's things I can do. So yes. That's a huge positive I see as far as using the MRI.
Oh, yeah. And as a physician, having patients bring the reports to me, it's an opportunity for me to take a different look at them as the patient. Because I'm their primary care physician. So I've done their annual physical exam. I've listened to their heart and lungs, pulses, abdominal exam, all those things. I've done blood work, but then to have an extra set of data that I can use for patients, I love it. Because with these scans, there's going to be something detected in everyone. Mostly minor, some things major, but there's always going to be something detected. And it's usually something the patient wasn't aware of. But there are things that are important for us to know. For example, I mentioned a patient with one kidney. Well, we needed to know about that. Or a patient who has a thyroid nodule that was not detected, was not able to be palpated on my physical exam. So we can then do some additional thyroid testings, maybe do a follow-up image of that thyroid nodule. Based on that follow-up image, then they may need biopsy to determine, is that a malignant nodule or a benign nodule? And again, this is in a patient who is asymptomatic, not having any hyper or hyperthyroid symptoms. They weren't having problems swallowing because of the nodule. Their thyroid blood tests came back normal, which can happen with thyroid nodules that are malignant. The blood tests can be normal. And their physical exam was normal. I was not able to palpate the nodule based on where it was located in the patient. But with the MRI scan, it picked it up, and we were able to then go down that path of workup from there. That's just one of many examples of how these whole body MRIs are utilized by physicians like myself. And it gives us the opportunity to talk about the patient's health status with them. We can triage and prioritize the findings. Most everyone in these MRI scans are going to have some sort of degeneration or disc issue in their spine, whether it's cervical, thoracic, or lumbar spines. Those things may just be minor findings. Some women may have uterine fibroids or ovarian cysts that may be affecting their fertility. So it gives us opportunity to talk about if they want to have children. Are they having pelvic pain with menstrual cycles that they haven't disclosed to me? Sometimes patients don't always just disclose their symptoms because they don't think it's important.
Right.
But the MRI report gives us the opportunity to have those open discussions.
Correct. Like I said, small stomach ache, it's probably something I ate. I've been traveling. My lower back is hurting, but that's actually your liver or fatty liver disease kicking in.
Yes.
Things of that nature. So this kind of, and there's also the cases of people are afraid to tell their doctor of things and sound like they are the hypochondriac that we all deeply inside are, right?
Yes.
So if we can have at least some data behind it, I'm a huge data junkie. If I have this out there, maybe I there is justification for it, or give you that reassurance that it's not there.
Yeah, that peace of mind, which is also invaluable, I think priceless for patients to know that they don't have a cerebral aneurysm. So when they have a headache, it's not an aneurysm.
Yeah, such in
and
my
this
case.
is like in your case, I've
had family history of my mom had an aneurysm when I was 18. And so every time I got a headache, I always thought, this is the one. I'm coming for you. I thought I'm going. That was it. And it wasn't until COVID that I really thought one of my symptoms of COVID was I had that huge headache. And it was always one of those things that was in the back of my mind. Is it there? And when we did my MRI, and it wasn't there. And I had a beautiful picture of my brain, the vascular system of my brain. And I could see it there, right there on my phone. It was that reassurance. Now, there was other things that we found that you were able to run more tests out there to say that, these are just normal little whatever, little masses in there, but there was nothing cancerous on there. But, obviously found degeneration in my knee, which I knew I had, but I was ignoring, kind of pushing through the pain. But it was good to see those findings on there.
And then we were able to, when we went to see the orthopedic surgeon, we were able to show the surgeon the report and the images, which helped to aid in that specialist evaluation as well. And I personally have had one uterine fibroid that showed up, and I was able to show my gynecologist, and she said, well, it's not anything to worry about based on the location, but it was really neat for her to see because I didn't have any issues before to warrant a pelvic ultrasound or pelvic CT scan. But when I did the whole body MRI, it showed a very small fibroid, talked to my gynecologist about it, not a big deal, move on.
Well, it helps speed up the diagnosis too as well.
Exactly.
So you're not spending time doing other things out there, which, can also increase the time. Because as we know, most times it takes a long time to get with a specialist and schedule those appointments and take time off of work and all the other fun stuff. But with that being said, let's kind of jump into this, which most people don't want to talk about, is the negative sides of it, or what is perceived as negative or risky MRIs. And we've all seen the doom and gloom online.
Yes.
We all have access to YouTube and other avenues on there. And there is a good versus evil battle going on about these things like whole body MRIs and other tests out there. So let's jump right into that and kind of get your take on some of this.
Yeah, it's interesting in the medical community. You're either pro whole body MRI or you're not whole body MRI. Like you're totally against it. There's nobody with like a middle ground. And so coming from the medical community, I'm a board certified physician. I used to be in that industrialized healthcare system that was dictated by insurance companies before I opened my own concierge private practice. So I understand where the physicians are coming from, but I disagree. And so I think the two main things that physicians are concerned about with whole body MRIs are, one, the risk of false positives. They think that by doing a whole body screening meaning that the patient does not have any symptoms, they're asymptomatic, doing these whole body screening tests can find false positives. And yes, they will find masses, tumors, cysts, whatever it may be, that are benign. They're not malignant. They're not cancerous. There's nothing wrong with that, because what if it detected a true positive, meaning it was a cancer? It was something that was malignant. It's something that we needed to know about. And because we caught it early, we were able to save your life. And so I look at it as, sure, we're going to find some false positives. And yes, if we find a mass that's concerning, we're going to order additional blood tests, additional imaging. And then it turns out to be benign. Great. That's great news. But if it's a mass that we do the workup and it's cancerous and we caught it early enough to do something about it and increased your 5-year survivability rate by 60%, why not?
Yeah, well, you hear all these stories about these famous people, because obviously the news is going to talk about the famous people that pass away.
Yes.
You talk about a big one, Patrick Swayze, pancreatic cancer.
Yeah.
Could he have been tested earlier? There's obviously, like, you hear the news, if it was made widely available, or if it wasn't stigmatized on there, and let people make their own judgment on these things out there. Let them take their healthcare and their health decisions on there with more education in the background of it, and given the opportunity to do something like that. let the patient be the one that says yes or no, because these are out of pocket. These are patients paying for them. It's not coming from insurance. So yeah, I can see the anxiety increase, which is a highly thing they talk about is your anxiety going through the roof. But last time I looked, everybody in the world has anxiety now. So it's find me one person without anxiety. And that's the case study I want to see. Yeah. But to me I would rather have that information saying, all right, let me talk to my doctor about this. I was nervous before I got the test back was I going to have an aneurysm? Was I going to go through what my mother went through? Am I going to have pancreatic cancer? Do I have the 5 days to live, right? I would rather know. Give me the opportunity, if I had rubbed that genie's lamp right now and that genie can ask me one of my questions after I get all the money in the world, which would be one of them. But would be the second one is, when am I going to die?
Right.
I would like to know so I can fill those days.
Yeah. I don't want to just sit and wait for something to happen. That's a very passive approach. And we have these tools out there where patients can be, again, proactive, have an active role in their health.
Yes.
And I think the second reason why the medical community and physicians are against these whole body MRIs is they say, oh, well, it increases patient anxiety. My rebuttal to that is anytime I recommend one of these MRI scans for patients, we sit down and we talk about the expectations. What is the scan going to be like? How long are they going to be in the machine itself? What is the facility like? And what do we do with the results? And for my patients, we sit down together with the detailed report and we go over all of the findings, both major and minor, and we triage, we prioritize what needs to be done now, what needs to be followed up with in a few months, and what is just a minor finding that we just need to know about and move on. And with patients having that mindset and that plan of action already in place going into it, it eases that anxiety. So I disagree with the medical community saying that we shouldn't do that because it'll increase patient anxiety. As you mentioned, everyone's anxious. They're going to be anxious because of a traffic jam on the highway. They're going to be anxious because their kids are acting up. There's not a reason to not do it.
Or if you get a positive finding on there that you're anxious, what do you do then? But at least if you have a healthcare professional behind you that is supportive of these things, because data is, whether it's positive or negative on there, you still have the data that says that. You still have data, oh, I don't have cancer, I do have cancer. Yes. Then you can then attack it. And at least you can be informed on there and have some type of game plan on there. And I think that to mitigate some of these, like you said, there's blood tests out there that you can take out there. There's genetic testing on there that may lead you to want to do the whole body MRI.
Right.
So, but if you have a finding on there, you do the blood test and you can then start digging into deeper before you go into the invasive biopsies and things of that nature in there. So there are different ways to step down there from it. And I think that a lot of the things you hear online, they don't talk about the new technology. They talk and they demonize some of these things out there, which is surely just adding more data to it. And I think that healthcare needs to change because we need to see that as we evolve with our environment around us, with technology, to utilize that technology and put our head in the sand, I think is pretty dangerous in itself.
Yes.
And to make the comments and to go out there and say, to reduce my anxiety, I'm not going to do this, right? So that's like saying going outside because I don't have a raincoat, so I'm not going to go outside today.
Yeah, at that point, I mean, why even do anything about your health? Why not just go to McDonald's every day and watch 10 hours of Netflix?
Yeah. All right. So the next subject I want to talk about as far as the negativity risk is price.
Yes.
I love this one. This is my favorite one to go after because it's the MRI that we did, the full body MRI was $2,500, which sounds steep right there, right? But I also have a $6,000 deductible on my insurance. And I just saw a commercial for the Apple Pro Vision, which is $3,500.
We were just at the mall yesterday and
I saw a purse.
By, Louis Vuitton, and they had,
there were people
purses
in there
that were much more than that.
Exactly. And so to have price on there and talk about price being an aspect of your health, it's all about what you prioritize.
It is.
And if you prioritize your health and this is something that you want to go forward, I would rather knowing that I look beautiful on the outside than have that Apple Vision Pro or the new Apple iPhone you get every year. Or the fresh kicks that you're going to spend, how much I don't want to talk about how much I spend on shoes a year.
Right. You have a lot more than me.
Yeah. So, but those are things out there that you can beat it down as much as you want to. You can always find negative aspects of it. And to me, I think the the positives outweigh the negatives on there in my personal experience. And I think everybody kind of needs to take this, have a discussion with their physician or with themselves. And if they don't have a physician that they can reach out to readily, like I can, or your patients can, then I think they need to kind of, look inside and say, hey, what do I need to look at? Do I think my healthcare is important enough to spend $2,500? And hopefully one day the prices will come down, like anything, like the blood tests, the genetic testing. They've come down drastically. Yeah. They were thousands of dollars years ago. Now they're a few $100s. Yeah. So as they become more mainstream, do I think insurance will ever cover them? I don't think in the near future until insurance gets that, but that's a whole nother conversation.
Right. That's for another.
Yeah. If we have another few hours for that, and I'll bring my tinfoil hat for that one.
Right.
But
yeah, I think the cost should not deter people. I think having that peace of mind and knowing that there isn't a brewing cancer, an aneurysm, or any other disease inside your body, I think that's priceless. I don't think you put a price on that. And look at it as investing in your health. For my patients, we have our concierge practice, and patients invest in a membership with us. And I think more and more patients are seeing the value in investing in their health, not just relying on insurance to cover it. Because insurance is, at the end of the day, really sick care. And you have to have a diagnosis with insurance before insurance will cover anything. Well, how do you get a diagnosis? In the traditional industrialized healthcare system, it's when you start to have symptoms. But you can get a diagnosis with the whole body MRI scan that can save your life.
Well, it's like you talked about earlier, like it's that paradigm shift that we're seeing in the last few years. People are being proactive in their health. They're realizing that the things in the environment are affecting them, that they're, we already knew this for the longest time, that, if my father had this, my grandfather had that, then I can have this. But now we're realizing there's other things out there. So people are looking at their health out there, that it may be environmental, it may be something I'm eating, maybe the fact I don't exercise, or I forgot to do this, and I haven't seen a doctor in 10 years. Let me go be proactive about it. So they are realizing that, that 7 minutes with their physician isn't going to cover it. Right. I need to go out there and be that. And they're obviously with information at our fingertips now, that we can go out there with ChatGPT it, or we can Google it, and these things out there. But we also still need to talk to somebody that can really, explain to us what it is. And now we can go get the data and show that data to our physician, or our physician can walk with us to that and be our partner in health with it to really interpret these results out there. Yeah. So I think the paradigm has shifted where people are being more proactive in their health.
Yes.
And it's great to see that there are tools and diagnostics things out there to do it. Even with the anxiety of having it, or the possibility of false positive, or there's things out there that we can do to mitigate those risks. I guess what you're saying on there with the blood test. And I would say you are in the camp of pro MRI.
Yes, definitely. I'm definitely pro whole body MRI. I am pro a lot of this new technology out there, especially these direct-to-consumer products for health that are available for anyone to do. I love it. I love the way healthcare, I love the way this proactive approach to healthcare is becoming more and more popular.
And as a patient, I agree. I love having to know, because deep down I'm a hypochondriac, and I know there's, my stomach hurts. What is it? Was it the kimchi, or is it stomach cancer? Right. So I definitely want to know, and I'd rather know than not know.
Yes, for sure.
All right. I think that kind of about wraps it up.
Yeah.
From here, we'd like you guys to subscribe, like, comment, anything on there, and we'll respond back to comments. That's about it.
Yeah. Thank you so much for joining us today on Your Partner in Health podcast.